And after hearing what all Ilaj has been doing and aspires to do, it brings me a lot of hope for the health tech industry in Pakistan, and proud as well because look at all the advancements that are being caused in our own country. Now we've got a very insightful panel discussion, and I would urge you all to listen carefully because this panel discussion is going to be about integrated communication and awareness, a strategic priority in digital health. The session is going to be moderated by Dr. Maida Irfan, and the panelists will be M. Suleiman Khan, Ahmed Ansari, Dr. Hina Kol, Faizan Ahmed Tirmizi, and Atif Hafiz. So over to you, Dr. Maida Irfan.
All right. Hello and Assalamu alaikum, everyone, and welcome to the HealthTech Summit by CXO Global Forum. I'm Dr. Maida Irfan, a health tech marketing expert with Seven Health and Seven Solutions, proud partners of this event. I'm excited to get this discussion going. The topic of this panel is integrated communications, a strategic priority for digital health. But just before that, I'd like to briefly introduce all the panelists that we have here today. So we have Dr. Maimouna Azhar, founder and CEO of Telligence, a cloud-based platform used to train healthcare professionals for remote patient care. We have Dr. Hina Kol, Chief Medical Officer at BIMA, focused on democratizing healthcare through accessible and affordable digital health solutions. We have Suleiman Khan, specialist in healthcare marcom and strategy with over 15 years of industry experience in Pakistan and the MENA region. We have Ahmed Ansari, head of communications at Shaukat Khan Memorial Trust, with diverse experience in development, communications, and digital media. And we also have Syed Faizan Ahmed Tirmizi, a director of medical technology and innovation and co-founder of two social enterprises, Saving Nine and Social Medicine Initiative. It's a pleasure to meet you guys and look forward to starting this conversation. So I'm going to start off by addressing the obvious that we're seeing right now in the healthcare space and how it's seeing a digital transformation. And it's really seen a paradigm shift in terms of the patient-provider dynamic. And the patient now, being the primary consumer of healthcare, has the most control now and autonomy and power in terms of access to healthcare, in terms of the options, in terms of just driving this digital transformation. And so despite these rapid advancements, studies show that we're still seeing some resistance in the digital adoption and in the usage, and there's still a certain sense of lack of awareness on the patient side. And now, this implies that there's a gap and there's a communication gap between both patient and the current scenario in the healthcare industry. And even big names, tech conglomerates like Philips and like Siemens and GE, they are now starting to realize and incorporating people with the domain expertise and the domain knowledge to help them effectively communicate the benefits of this technology to the end users. And so my first question, I'm going to direct them to the doctors on my panel actually first, that how important do you think it is for clinicians to step into the health tech space and help with healthcare marketing and communications? Dr. Maimouna, if you'd like to start, please.
Thank you, Maida. This is indeed a very, very important question. And I think a lot of the problems that we have in the healthcare space at the moment is because in a lot of decision-making and policy-making arenas, we don't have representation from the end users. So end users would be doctors, and in fact, all the healthcare providers for that matter, not just doctors. All of the service providers, physiotherapists, nurses, our lab scientists, all of them, and the patients and the administrators. So until and unless all the stakeholders are involved in any kind of decision making for service delivery, there are going to be loopholes. There is going to be lower satisfaction amongst the patients. There is going to be, frustration and other issues amongst the service providers, because obviously it's not just a matter of patient satisfaction, but also a matter of how satisfied you are as a healthcare provider at the end of the day. Are you able to get that satisfaction from the job for which you signed up? And the key reason that I identified from my work experience in clinical education for over a decade at this stage has been lack of training, and precisely lack of training in communication skills. Communication skills are so relevant across all domains, and more so when we are dealing with, it's a patient-doctor relationship or any of the healthcare provider and the patient relationship. So like you said, it has been identified that there is a communication gap, especially in the context of telehealth. And I'm sure Hina will be able to enlighten us more in the light of her experience as a telehealth practitioner. There's a lot of training involved, because remote patient assessment skills is a different skill set in its own right. And if I restrict myself to, practice of clinical practice in medicine alone, it is a different skill set. And we need to train our graduates, our medical students, right in the med school, when we train them in various clinical skill sets, like in history taking, in physical exam. We have entered an era where now we need to train them in telehealth as well. There's no going back to saying, okay, this is just a software that they can learn how to use on the go once they sign up for telehealth. No, the etiquettes, the ethics of telehealth consultation are slightly different to what we do in an in-person consultation. So it is very important, it is imperative that it becomes a part of medical education curriculum. And obviously policymakers definitely need to consider this. This is going to be a global phenomena. Telemedicine has been around for nearly 2 decades or more, but obviously it was pandemic which accelerated its way into healthcare globally. And this is one thing which will stay even after the pandemic is totally gone.
Thank you. Dr. Hina, what are your insights?
Thank you so much, Maida. Thank you, Maimuna. And I think I will agree with you 100% about it. Just only my 2 cents would be that, as you mentioned, that being physicians and being clinicians, we are at one end of the care delivery providers. But I think one thing which we are missing most of the time in especially during the time of pandemic also, that we definitely work on our capabilities and our training wise also, that we did train a lot of doctors on telemedicine and how to deliver it in the right way, and how to take care of customer satisfaction and everything around it. But the thing is, we are not just considering to actually go and listen to the receiving end also, and speak to the patients also, that what do they want, where do they think that something is missing, where are we not connecting their concerns with the services we are providing. Because I think most of the time, and what of course being organization, telemedicine organizations, everybody is trying to do their best. But the thing is, one thing is missing, and we are not actually actively listening towards the patients, that what are they actually looking for. And I think that will only be done by, as you mentioned, that having clinicians in the policy, having them as a stakeholder, and while making all the regulations, and while policymakers are sitting together, I think a representation from the receiving end also should be there. Then only we will be able to decide where the barriers are, how can we enable this telemedicine and digital technology to actually reach how we want it to reach the receiving end. So yes, this was what I wanted to say, and rest of the things Maimuna already covered.
Thank you. No, absolutely, 100% agree with you. Ahmed, I would like to hear from you actually, leading and being the brand manager of Shaukat Khanum, which is a healthcare organization. Where do you think the barriers of communication are, and what role can clinicians play in this?
All right. First of all, thank you very much for this opportunity and for composing this excellent panel. And it was really insightful to hear the thoughts of both doctors. From our perspective, so I believe I'll just agree with Dr. Maimouna here that the barriers in terms of how many different levels of healthcare providers are actually interacting with the system. And of course, they all have their different skill sets and prior knowledge, which then needs to be consolidated on one platform. And so the approach that was taken here, Shalka Khanum being located in 2 different locations, having a staff of 4,000 plus. And, there are various stages of cancer treatment. At one stage, you're being treated by one particular set of physicians, then the other, then the third, and so on and so forth. And so for that, what basically was done was an in-house healthcare management system was developed, all right? And this was done with the support of Oracle technology. But that system was basically developed using the how might we do it framework. And so basically just for the panelists and our audience members as well, is that you try to frame your problem in different ways based on how might we actually do it, how might we overcome the challenge. And then you try to broaden the perspectives to include your different team members, you will include your patients, you will include your administrative staff, for example, over there. And that is the point from which on you'll start to tailor make a solution. And over the past 10 years, so the total savings that the hospital has achieved by eliminating paper entirely and shifting to this online system is US dollar 5.1 million, out of which the net savings have been more than 3.5 million. I would further like to add, based on the other opinion that we just heard as well. So training, especially with regards to regulations, so patient privacy, data protection is very important. And it is also very important for these systems and for the people using them to be flexible. With the speed that the technology is changing, that social media is changing, it's very important to understand that provision of healthcare is very closely related with society, with social transformation, and with behavior change. So as long as you keep that sort of flexibility inbuilt not only into the system, but into the behaviors of your staff, your people as well, that is how it will continue to be successful. And just to conclude my point, so currently our healthcare information system is deployed at 7 hospitals across Pakistan, which includes 2 public sector hospitals as well.
Great, amazing. Suleiman, how would you, I want to channel your 15 years of experience actually, and I want to ask, where, because you've worked in the MENA region, I'm based in the KSA, and I still get the same feedback from the developing world, so to see, the developed nations. And, we still get the same sort of problems here as well. So shed some light on that, please.
Yeah, thank you very much for this opportunity. See, it's a level that basically first I would like to say. And yes, I think I agree with what Ahmed has said, that there is a big gap in communication and how clinicians basically see these new facilities that I use the word facilities because I feel that the systems that we are providing to the clinicians, to the hospitals as hospital management systems is basically facilitating both clinicians as well as the hospitals in reducing the cost as well as the burden that they have to bear. But living in Dubai, seeing the multinational hospitals going there, I see that the senior doctors, especially, I would say that they are very reluctant to adopt to the new technology. They are still very much ease writing with the pen and pad and giving out their prescriptions and writing their on the files whatever diagnosis they have done, right? Instead of, as I compare to the newer generation of the doctor, which are not that much, unfortunately, right now, still a majority of the doctors are very senior. So the newer generations, yes, they are coming up and they are more adaptive towards the new technology. They are more hands-on practice with the laptops and computers and writing by the keyboards. They are more better. So yeah, there is a big gap. And I think I agree with Dr. Maimouna said in the beginning that we need to get our education system integrated with the IT basically. The Until unless the med schools, med universities, med colleges, irrespective of they're doing for MBBS or for pharmacy or for technicians or whatever, until unless they start providing a proper subject, at least a basic proper subject in which doctors should be trained that at least and become computer friendly, or I should say, most of all, tablet friendly, because now, especially in Dubai and more modern region, they are also leaving tablets. They're adopting tablets instead of computers because it's more easy, and it helps. Like it has a pen and paper like adaptability in that. So, but still, I believe that we need to work with the grassroots level, where educationalists and the corporates should also play a big part. The the health tech corporates, as well as the big multinationals like GSK, Pfizer, and all these companies, because they have the resources, they have a lot of experience. So they should come and they should have a partnership with the med schools, med colleges, and they should come up with that what type of solutions. And not only the pharmaceutical industry, the big hospitals. I would like to say that hospitals like Chicago hospitals, Chicago Children's Hospital, London King's Hospital in London, like these type of organizations need to come up with a plan to integrate IT and come up with digital solutions and courses that docs could learn before they come into the practical life. And that
Excellent.
will definitely reduce a lot of gap that is there right now. Yep.
Thank you. And Fazan, I know that you've started social initiatives to actually facilitate healthcare providers as well. And so where do you think, and at an individual level, you've taken that initiative yourself. So can you please shed some light on that and how one can, facilitate this process? Facilitate this communication process.
Of course. So I would just like to, I would love to address the points pointed out by my esteemed panelists, but just to give a brief overview. My work is mostly centered around rural populations, and it is not just in Pakistan, but in America and Afghanistan as well. So Social Medicine Institute has been set up to accommodate all of the questions that have been raised today, and to really help transmit that sort of learning in the education wing, whether it's hospitals, private hospitals, public hospitals in the urban areas, or it's the rural areas and local communities over there, right? So we have very two diverse set of populations and the way they operate these things. What my interventions have revealed essentially is that there is an extreme lack and deficiency of locally contextual case studies upon which we can actually disseminate the sort of digital literacy that is needed. So while Sulaiman Saab rightly pointed out that there are experts around the world to do this, I think one of the failures that we come across when we try to apply models from the outside over here is actually the nuance of culture and history which is associated with that particular community, right? So even if you're looking at Pakistan, if you look at the rural community, the way you will be transmitting credible healthcare information is very different, whether it's linguistic or semantic, in purpose for linguistic or semantic purposes, or whether it's the urban area, right? So just to give you a brief example, even so I'm also a co-founder of Saving Nine. We equip communities with emergency response systems and teach them first aid. It is surprising to tell you that a lot of doctors actually reach out to us for first aid training, because this is something that is not covered as such within that curriculum, right? So is just to take the takeaway from this point, overall thing would be that that Dr. Maimuna talked about how it's very important to embed these things within our education curriculum. It is also very important to realize that we do not have credible data to be able to pilot these things over here. And once we bring these models from the outside over here, we try to fit a one size fits all model into this, right? And the issue is that these areas have higher resources and have more educated masses. When you come over here in Pakistan, the situation and demographics are very different. The situation of inclusivity, especially for women and marginalized communities, is especially a huge issue. And those are the communities that are facing these things, facing this or suffering the most. So, in a nutshell, I would say that locally contextual telemedicine is the need of the hour. The local patient mentality is still to face your doctor in real life. The doctor should have that white coat on. Otherwise, that won't be a credible exchange of information in their psychology. And to educate them and make them aware of all of these things is a big struggle, especially in rural areas where you have humongous logistical constraints. You start off with an intervention, and in between, with a telemedicine intervention, in between you get these sort of logistical constraints with device incompatibilities, or the telecom strength isn't enough. And so your model starts falling flat on its face. And so what you need is actually, I would take a different route from what Suleiman Saab said. We need local, contextual, low-cost solutions, something which Mr. Asad Mia also talked about in his previous talk, that this is the need of the hour. We really need, the word is jugaad, right? That jugaad is needed. It's desperately needed, and something that people, that these communities immediately hook on to. Finally, my point would be just to rely so much on AI in especially rural settings is something that still needs to be piloted out, right? Instead, what can be done is this gradual phase towards technological progress. So humanity for the longest time has been, for the longest time in the past 200 years, this is not actually a long time. For the past 200 years has saw this skyrocketing technological progress, but the moral and intellectual progress of humanity as a whole is still accruing at a much slower pace. And so the divide is humongous. So we really need to see how to fill those gaps at a local level. And for that, we need local people to actually be able to contribute. So it's very easy to bring people together in one room and then expect that communication will work. If they are from different diverse backgrounds, there are often concerns which are not voiced because of the presence of people over there and certain people being more outspoken over others. So we really need to come up with good referrals, good feedback systems for this to work out. So I would love to listen to anyone about this.
Thank you. No, excellent. And I'm glad that you brought up the rural population. And it's such a beautiful segue to my next question, which is that, one of the biggest problems that we're seeing right now is that the different domains and the different sort of segments within the healthcare system are great at operating within their own sectors. But the interoperability, they don't talk to each other. So for instance, telemedicine is doing great, medical insurance is doing great, emergency ambulatory modules are doing great within their own sort of sectors, but then they need to communicate with each other to improve the patient experience, as well as for better outcomes, and that requires a more sort of synchronized communication strategy because they need to talk. And this is, in other words, we need better interoperability. So my question is,
and interdisciplinary appreciation as well.
Right, absolutely.
That's
and so
really
the question
different.
is, right, and so the question is really, how can we improve this interoperability? How can we get different segments of healthcare to come together on one page, talk to each other, find those gaps, identify them, and then work on them? So the floor is open if anyone wants to start talking about this.
So yes, I would like to just start with that. I think this is really crucial, and without having this liberty of interoperability, we will be losing a lot of essential data, which define what healthcare is actually. So if someone is in rural population area, 65% is of our population is living there, and we are giving tele consultations over there, and we have their electronic health record system with us, and then we refer them for something to for tertiary care or anything. If that data is not transferable and only patient is traveling from one place to another, then the quality care can never be provided, this kind of setup. So this is crucial for having this digitalization all over the medical industry, that unless and until one organization is not going to shake hands with the another organization and having this data security and data privacy in place and giving that patient the autonomy of their own data, we won't be able to provide, the right care, and we won't be able to revolutionize the healthcare industry. So I think this is the need of the time, that we start thinking about one health lingo which all of us can sing together, and that will be basically good for everybody then. So, yeah.
Right. Thank you, Dr. Nano. I agree. Where specialization is important, where focused work is important, so is the commonality, where we all come together. Please, Suleiman, go ahead.
Yes, continuing from what Dr. Hina was saying, like I was working for one of the biggest organization out of the MENA region, which had its own 16 tertiary level hospitals, out of which like a couple of them were medical cities. But unfortunately, they were not talking to each other. Their data was not integrated. And the main idea of the group from the chairman and the management was that basically that if a patient, I have a chain of hospitals in, let's say, in a country, and if my patient is traveling from one city to another city, he should not either carry a whole briefcase or a file of his medical records. If he's, let's say, he's a diabetic or he has a cardiac problem, he should be able to move from one place to another, go to the same hospital branch, and his record should be pulled out using his MR number or anything like that. But unfortunately, the group itself did not have the capacity and capability of talking to each other digitally. The reason being, what I found out is that number one, patients were scared of letting their data and their personal files and their records being shared publicly or to be shared on the cloud, because they are still not sure of the security. Digital security is a big concern over there. Secondly, each hospital has its own CEO, although the management is same, although the decisions are coming from the top, but the people who are running the show on the ground are different from even, and they all feel, because that at the end of the day, they have to show ROI, they have to show the profitability, which is the main thing. They have to show that, oh yes, our branch has done this much, our branch has done this much. This is the department that is very effective, right? So in this scenario, they don't like to share the data. They don't like to share the information. Whereas I was telling them that, on the contrary, if, for example, if there is a cancer department or in MENA region, the two biggest diseases, diabetes and cardiovascular diseases. So if you are sharing the data, then definitely one place the doctors can use that data more effectively and efficiently to diagnose other patients based on the data that has been already used. So I believe that intercommunication of the hospitals, and for that, I believe that first of all, I think that governments of each country has to come up with a solution that they assure that there will be a data integration and that there will be a data security. Because I believe no matter how much a company, even multinational companies like Microsoft or Oracle or Apple, they give a guarantee that will not be good enough for each and every patient until unless there's an involvement of government in that. So I believe that governments should start playing a big role in healthcare and start giving its due respect and due diligence that it needs at this time now, especially after the COVID pandemic.
Agreed. Anyone else have any points to add?
Yes, if I may. So first of all, just building upon what Dr. Hina said, and in support of Faizan's opinion as well. So the one successful example, which I can quote, is a system we have here at Shakhanam, and that is, again, something that was locally developed, custom made. This was not an imported solution, which we often see in various sectors, especially in the public sector, where things are imported and then copied and pasted and imposed onto the users. Number one. And secondly, in support of Suleiman's opinion, concerns regarding data security. So the protocols, for example, at this hospital are stringent enough that the actual servers are not connected in any way or form to the external world, number one. Number two, you cannot plug in a USB or any other device. And number three, any unauthorized or irregular access to a patient's records is immediately flagged. So whether it will be stopped at that stage or not, that is not something I can comment on, but it is immediately flagged for follow-up and a complete process of actual investigation, which then goes as to why an irregular user or a non-medical user, for example, would be accessing that. So that is just one example of a model that I have seen in practice. And having worked with the health department previously in the Punjab province, so a couple of the challenges that I can foresee are, number one, the province after the devolution and the 18th Amendment, so the provinces are pretty much completely free on their own to decide what protocols they want to have. And the second challenge would, once again, going back to how Fazan mentioned, is that actually making the doctors, the paramedical staff, the other administrative staff, plus the patients adapt to and understand that the tablet or the laptop they're using is equally effective or even more effective than a folder of paper reports.
Yeah. Faizan, would you like to say something?
Sure. Just giving a brief overview of what everyone talked about. I think so there are three stages of interoperability, I believe. The first is foundational interoperability, in which you just equip systems to receive data, right? Then you go towards a standardized approach of structural interoperability, where you have a standardized model which allows you to have basic interpretations of it, right? But the highest form is the semantic interoperability of it, which is making meaningful use of it along with being able to receive data and interpret it. So we just need to focus on how we're going to be rising up that staircase, going from foundational interoperability to semantic interoperability. And that is the struggle in itself. Now, just like Ahmed said, all of the credible evidence that he gave right now, I have been a teacher most of my life, and I've taught multiple subjects in sciences and social sciences. To be able to trickle down the information that Emma just pointed out to someone who is in a rural setting, or even a doctor who is in their late 60s, right? It's a big challenge. If you sit them down, you're talking in a lingo which makes no sense to them. You're ostracizing them. You're making them feel intellectually inferior. And that sense of communication then just goes away. So what we need is people who are representatives, who these doctors who are in their 60s, or these rural communities who people trust, right? And they are able to, we teach them how to do it and trickle down information in such a way in which that becomes acceptable. So again, having these systems integrated in hospitals, we've started the whole dynamic of it, but to actually be able to make it inclusive and make people trust us. Like, surveillance is a big issue right now. If you look at big data groups from Cambridge Analytica to the whole world is trying to figure out how to manage surveillance, right? I mean, we give examples of communist China, but then when you have liberal democracies coming up with these sort of theatrics, then one really needs to wonder how one can ensure that sort of privacy and security in this world. So, and honestly, these are nuances which the rural community are not even aware of right now.
Right. No, thank you. And, just because of the time constraint, I'd like to talk a little bit about social media. I think that it's become such a big part of our lives. And so that we've seen this trend of healthcare professionals and clinicians going on to social media, becoming influencers, using social media for healthcare awareness and a lot of other things. But with that comes, legal and ethical pitfalls. As they say, that with power comes responsibility. And so I've seen a lot of healthcare organizations and institutions, implementing certain policies regarding to their to protect the reputation of their institutions as well, social media policies in place. And it's called good digital citizenship in the health profession. And so, my question is, how do you think we can encourage and use these digital touch points while staying within the regulatory guidelines? But all the while, also, we want to improve the user experience, because the consumer is largely on social media. So we need to use this communication channel to connect with them. And so, Dr. Maimouna, I'd like to hear your opinion on this.
Thanks, Maida. It's been very insightful discussion so far across various domains. And one thing from the previous discussion, which also leads us into the question you have just asked me, is about the patient data. And world over, this is a huge concern. And like Suleiman pointed out, that even within a hospital group, just the different branches are not able to share data. Talk about sharing of data between two different hospital groups or from one country to another, that would be a big no-no as it stands at the moment. So there are huge regulatory and policy issues around this. And one thing that is a ray of hope, to me at least, as much as I've read on it so far, is personal health records that the healthcare professionals and the policymakers are now talking about. Hopefully that will give us some kind of leverage, or it will be a kind of a bridge while the policies are being made around handling of these situations. Regarding the use of social media, yes, it's a huge responsibility. And again, it's not uncommon to see medical students, especially, uploading any of the exciting things that they did on their wards, in the operation theaters, without even needing to ask permission from the patient, who may be an illiterate person, but still that person has dignity, and we need to acknowledge that. And this is so important. And now that all of this phenomena, we cannot close our eyes to social media. We cannot close our eyes to all of the tech stuff that is happening all around the world, even in Pakistan. And now even going into the rural areas, as Faizan is, I'm really impressed with all of this work. A lot of this needs to be happening in the West, and we don't see it happening here. And it is happening in Pakistan. So this is, really, really something very pleasant to see. But yes, we need proper guidelines while our healthcare providers are in their training phase. So there needs to be talks about this. We need to have, even though a lot of this is general knowledge, a lot of this is common sense, a human being should be responsible enough while sharing information that relates to other individuals. But unfortunately, that's not something that we see, in being in practice with a lot of individuals. So that's one thing. The other thing that I want to point out is I completely agree with what Faizan said about the one-size-fit-all ideology. One size definitely does not fit all. We can use the interventions and data from other settings, but then what we need is the process of design thinking with bringing all the stakeholders on board, having multidisciplinary approach within the healthcare sector, and then coming up with solutions and policies to regulate, be it decision-making on our service delivery or our social media management, because these are things which, if it's a healthcare institution, all the academic staff, students need to be aware of. If it's a hospital, all the employees need to be aware of. So definitely involvement of all the stakeholders and making policies is the key to all of this, in my opinion.
Thank you, Dr. Mamoona. And just to wrap up, guys, we've touched upon a lot of different topics on a smaller scale, but when we look at it at a bigger scale in terms of competitive advantage, we really need to talk about everything together, right? So we need to talk about the telecommunication industry and the skyrocketing internet penetration, the 70% rural population that Faizan mentioned, the government policies that we've talked about, and the communication strategies, and the boom in health tech startups as well, and what their role is going to be moving forward, but then also the dire need and the dire deficit of experts in the healthcare marketing industry. So just as we wrap up, if you guys want to have a few words to wrap up this conversation, that'd be great, starting from Faizan.
So just to make your question clear, we're just talking about how technology can set into the nation, what potential opportunities we have to capitalize on, right? And where we have these efficiencies.
And any message, that you'd like to give in this context.
I think we really need, so I think according to World Bank estimates, 37% of the population is still offline. We really need to understand what online and offline being means. If you're online and you're just able to send a WhatsApp voice note from a rural setting where you get WhatsApp packages over there. That's very different from if you're able to access the internet to stream videos or have meetings, right? And that in itself has a lot of nuances attached to it. So like surveying the field and actually looking at the deficiency of the of infrastructure is very important to go about this. We need to make our rural population more inclusive. What I envision is a migrant effect. You see how people from third world countries go to first world countries and then become doctors and engineers in that societies. You can see that we will see a similar effect if we bring in technology over here, because having operated in the rural setting, I have seen that you have talent which just instantly is able to form a digital identity and be able to disseminate and become thought leaders in that particular process. So my 2 cents are these, that we need to make it more inclusive.
Thank you. Dr. Hina?
So I think that, just to sum it all, I think definitely the message of all should be that, our medical institutions should, start thinking about including tech subjects in our, basic health sciences education from the grassroots level. Again, then on the marketing side and on the, caregiving side, our strategies should be, bring the health awareness to the consumer end also, and although just try to think about what the essential needs of our customer is, because again the numbers what we have, the researches what we know about is from US and European countries. We definitely need our own data to understand what our target market is, how we can capitalize on it, and what are our needs actually. And along with that, we see a lot of multiple, healthcare or telemedicine companies coming in. But the thing is, we need to understand that we should sit along that what do we actually want to do for the betterment of our, patient and the consumer end. And unless we don't come out of those silos and start working together, we won't be able to provide what actually we are, visioning this digitalization. So my 2 cents would be actually that we definitely need to understand that, for example, Shaukat Khanam should understand that telemedicine organization would be sending to you. And we both should be meeting somewhere in between to understand what disease needs more attention. My doctors should understand that, if they are sending a lot of doctors for diabetes and they are finding, many new diabetics in the, lab test all the time. So we should sit together and decide how can we prevent, what is the problem, which we both can come together and, bring something out of it. So this interoperability and coming together would be great if we can, do something about it.
Thank you. Thank you, Dr. Hina. Thank you, Suleiman. Your 2 cents.
I would like to add one thing that everybody is talking about private sector and rural sector and everything. That what I have noticed in the Middle East and also a lot in Europe is that there are now people, their government, what you call private public sector integration, right? We are in Pakistan missing this big thing that we don't have a private public private sector integration. So like there's a big difference, there's a big gap between the private hospitals and the public hospitals, the technology. And I think what Faizan has been emphasizing on rural areas, if we have to go to the rural areas, it's not the only responsibility of the government only, and they don't have the resources that they can take the technology and they can take the doctors to the rural area. I think the private sector, it's high time that they should start partnering with the government and they should start playing their own roles, like organizations like Shaukat Khan, Amara Khan, and so other big organizations over here in Pakistan. They should take the lead and they should themselves go to the government and say that, hey, we have these technologies, we have these resources, let's partner. You provide us the hospital, because they have government hospitals all over the rural areas. They don't need to build the hospital. But what private sector can do is that provide technology and doctors. That's my 2 cents for it.
Excellent point. Ahmed, very quickly, please.
Absolutely. All right. So I think the experts have already chipped in really nicely on different avenues, but just a couple of things I'd like to add. So number one is that digital shouldn't just be limited to an app or video streaming or a website. We should also explore SMS messages, for example. They've been proven to be effective in rural populations. Number two, as far as the public-private sector partnership goes and prioritizing preventive health, you really need to step away from curative health for that. And our current existing public sector and private sector model is 100% focused on curative, not preventive. So I think that is a larger scale problem that should be addressed. All right, thank you.
Very, very important point. Dr. Mamoona.
Thanks. So basically, I think we have pretty much covered everything. And just one thing that I would like to share from my own experience as an academic would be with regards to curriculum at healthcare institutions. So basically, if you consider our the generation of med students at the moment, I don't think we will have a lot of problem getting them to do their clinical notes on iPads or, whatever digital devices. The major bottleneck that we have here is, like Faizan has pointed out already, is their examiners or the more experienced healthcare providers, the senior doctors who believe, and they very strongly believe in one-to-one physical interaction. And being a doctor myself and a clinical educator, I would always advocate for one-to-one wherever it's possible, but obviously it's not possible at all the times, and we cannot restrict healthcare service because of, if somebody is not able to make it for a one-to-one. And in that scenario, we need to use technology. So we are in a situation where we have the students who might be very willing to actually jump onto this whole thing, but we have their trainers who are not very keen for it. And their perception, like the perception of the trainers, the educators, the senior doctors, will only change when there is demand from patients. So it would be patient-driven. And that would only happen if we can somehow increase the level of patient satisfaction, and the demand for telehealth consultation increases from that end. So it really needs a thorough design thinking process by bringing all of these stakeholders on board and taking it from there.
Well, thank you so much. I want to thank each and every one of you for taking out the time. I had an amazing, it was such an insightful discussion. I'm sure we can all take away a lot of learning points from this. Thank you so much. Hope to do this again and enjoy the rest of the summit.
Thank you very much, Madam.
Thank you.
Thank you.
Thanks very much. Thanks, everyone.
Thank you.
Thank you, everybody. Thank you. Bye-bye.
Thank you.